Good afternoon. It's morning here, but it's afternoon there. My name is Brenda Wilson. I'm your host for the webinar that is being brought to you by the International Center for Journalists. Last week was Vaccine Week around the world, but that doesn't mean that reporting on vaccines should stop. ICFJ is hosting the webinar this week to give more journalists an opportunity to participate in this webinar. For many years, I was a journalist. As a public health and global health reporter, I reported on vaccines in the United States and in Africa. That included reporting on the response of the public to the introduction of new vaccines, following health workers going door to door to administer the polio vaccine in northern Nigeria, and examining something as simple as the problems physicians in a small town in the United States have in just keeping childhood vaccines stored. Today, the International Center for Journalists is hosting this webinar to give you a chance to hear from an expert on vaccines, who will serve as a guide to finding stories about vaccines and the challenges of getting them to children. We'll introduce her to you in a moment. According to the World Health Organization, it's estimated that more than 1.5 million children die each year because they weren't protected against diseases that vaccines can prevent. This webinar is being hosted a week after the Global Vaccine Summit that was held in Abu Dhabi in the United Arab Emirates. During the summit, Bill Gates pledged $1.8 billion to the polio eradication campaign, and the Gavi Alliance announced that Somalia would receive a special donation to cover the cost of vaccines that protect against a number of childhood diseases. There was concern expressed during the summit about the increasing cost of vaccines, which we hope to talk about today as well. I hope that journalists listening have taken on or will take on some of these issues and what they mean for vaccine coverage. ICFJ wants to encourage reporting on vaccines. Good stories can foster a better understanding of immunization efforts, costs, testing, delivery of vaccines, and effectiveness. In the interest of promoting good reporting, ICFJ is holding a contest that will award cash prizes and a 2-week global health study tour to the United States to the journalists who produce the best story about vaccines, if they are published between March 15th or aired or broadcast between March 15th and May 15th this year. For more details about the contest, please go to the ICFJ website, where a link to detailed information about the contest has been posted. So, if you have questions during this webinar, you may send them by text through the Google Hangout site, or if you are viewing the webinar on YouTube, you can send the questions by email to vaccines@icfj.org. At several points during the discussion, we will pause to answer questions, or we may do this at the end of the interview with Dr. Larson. We'll set aside time. But for now, let's just get started. Our expert today is Dr. Heidi Larson, a senior lecturer at the London School of Hygiene and Tropical Medicine, who has been monitoring the international scale-up of vaccines. She leads the Vaccine Confidence Project that was started in response to a backlash against the polio vaccine in northern Nigeria, which for a time stalled the polio eradication campaign. She'll update us on polio eradication efforts and tell us more about the Vaccine Confidence Project, which no doubt has great potential for stories about vaccines. Previously, she worked for UNICEF's Global Communication for Immunization, and she was head of the Gavi Alliance Advocacy Task Force. We think she will be able to help you think about the key issues that you, as journalists, will be dealing with as you report on vaccines across Africa. Perhaps give you fresh approaches to stories you're already working on. But first, we'll have some brief remarks from Dr. Larson. Dr. Larson, welcome, and thank you for being with us.
Hi, thanks, Brenda, and hello to the participating journalists. As Brenda said, I got into initiating the Vaccine Confidence Project because during my years as the communications director for UNICEF's global immunization work between 2000 and 2005, we saw outbreaks of vaccine refusals, like we see outbreaks of diseases, in pockets around the world. The biggest one that I'm sure most of you have heard about was the 11-month boycott of the polio vaccine in northern Nigeria. But there were different levels and different types of communities, individuals, and even governments in some cases questioning or refusing a vaccine for numerous reasons. And one of the things we found was that they weren't always about the safety of the vaccine. They were about a number of reasons, and some of them were quite valid questions. Some of them were rumors and misinformation. But I started this project to basically constantly try to capture through media, social media, and other forms to start listening to people around the world and what they were thinking about vaccines, so we could understand when there were questions early, rather than wait to find out that there was a problem by seeing that a program was being shut down or that we see an outbreak of disease, like we are in the UK now with measles. So, and frankly, a lot of what we're picking up is local media around the world, and yourself and what you're writing we probably pick up on our system. But the issue that happened, one of the things we're seeing is that things don't die. When people have rumors don't die, perceptions don't die, people have historic memories. And one of the things we're seeing is that 1 decade later, 10 years after the boycott in northern Nigeria, we are still challenged in the polio eradication campaign by residual rumors and distrust in northern Nigeria. We also had similar rumors in northern India, and that was managed, and they've managed to eliminate polio, thankfully. But we still have big issues in Pakistan, and as I'm sure most of you know, the few we currently have only Pakistan, Afghanistan, and Nigeria are the only remaining countries that have what they call endemic, meaning indigenous, local, circulating polio virus. We've had a few cases in Chad, but those were imported from Nigeria. So we really have tremendous success. When the polio eradication initiative started, there were 350,000 cases annually. And the end of 2012, we only had 223 cases. And to date, we only have 24 in the world for 2013, which is half of the number that we had the 1st of May in 2012. So it's tremendous progress, but we still have some difficult areas, and some of those challenges are not just about the supply of the vaccine. They're not just about some of the basic delivery issues. A good number of them are about people's perceptions, about politics, about conflict, and about the context around the vaccine. And I think that from a journalist perspective, what is helpful to the public health community is to investigate and better understand what are the issues that are facing the delivery and acceptance of vaccines, because the public health community typically is focused on getting a quality, safe health intervention, whether it's a vaccine or a medication, to the people that need them, and that's the primary focus. And there's not often enough attention to the context that that health intervention or vaccine will be introduced in. And that's where we start stumbling across problems, and some of that is just not being aware of what some of the local issues are, that had we had better information, as it were, and paid attention to it, because that's another issue. Sometimes the information is there, but it's not being paid attention to. And I think as journalists, you can really be helpful in understanding what's really going on in areas where vaccines are not getting to where they could or should be getting, whether it's the new meningitis vaccine that's coming across in the central band of Africa, or whether it's the polio vaccine. Measles, some of them are quite basic vaccines. There's the new HPV vaccine that has a number of debates in different settings because that's more of an adolescent vaccine. And with being an adolescent vaccine, particularly one related to a sexually transmitted infection, that raises other kinds of moral judgments and political concerns. So when a vaccine is given raises some special issues. Where it's given, should it be given in a school or health center, or by whom is it given, and the politics and context. Is it a time of peace? It is a time of conflict. One of the other issues we're dealing with in the world is the repercussions of Syria and the amount of refugees and big outbreaks of measles in Turkey and starting in Jordan and in Lebanon. So conflict can affect even some of the simplest, cheapest vaccines. I think I'll stop here, but happy to pick up on any of those varied points I raised.
All right, we'll certainly revisit a lot of them, I think. Just to be on the safe side, I want to make sure that I gave you the link for submitting questions, so you can text your questions to the Google Hangout site, or you can send them by email to vaccinestories-africa@icfj.org. That's vaccine stories, one word, -africa@icfj.org. So now let's turn to the question of, I think, a big one in Africa, particularly in Nigeria, and that's the polio eradication campaign that got stalled, several years back. Now, as you pointed out, the cases have declined dramatically, but we also know that about $5.5 billion is being spent globally to get those cases down to zero. Now, if you're in some community where you're faced with really serious problems that may be killing children, it's going to seem very strange to you that $5.5 billion is being spent on a disease in which there aren't as many cases. Why is this being done?
Well, I think it's quite a big deal to eradicate a disease. I don't think people would, and I think it's being part of a bigger community and looking at a longer-term view where if we eradicate the disease, we won't have to be paying for vaccines in the future, and we won't have to be paying for the consequence of the disease in the future. And it's not even just about deaths, but with polio, it's a crippling disease. And people's ability to work and be productive and be earning money and being parents and not being stigmatized, it's not a small thing, and it's not always easy to put a price tag on. So I think that 5 billion, 5.5 or 5.5 the millions of dollars that they're putting the price tag on is really an investment in the future. And I think that when people, which is not easy to say or not easy to think about, when your concern is your immediate survival and the fact that your kids are getting measles and not polio, and you wonder why you're getting polio. So it's a challenging issue. It's certainly a question that UNICEF and WHO and ministries of health have been faced with in their communities. And I think one of the strategies that has been done is to try to embed the polio in the context of other interventions. But that doesn't always happen. And it's a challenge. I think, Brenda, you've pointed out an important challenge. And we always have this issue also with vaccines, is that it's not just about the health of an individual, it's about the health of a community, and it's about the health of a country and the world. And depending on how you feel and how much resources you have, your willingness to feel more about caring about the community versus your immediate survival is a difficult one.
You know, in many of the areas where the eradication campaign has stalled, they're in conflict zones, whether that's been in northern Nigeria or in Pakistan. You know, attacks on health workers, attacks on people protecting health workers. Are these stories that journalists can do? And how, I mean, does conflict necessarily stop immunization? What are some of the stories that can be done about, these sort of disruptions, or how much attention should be paid to them?
I think what's really important is to get the story behind the story. Because what happens sometimes is the kind of headlines that get out to the world, like the rumors about polio sterilizing, and it's Pakistan being kind of, you only think of conflict, and in northern Nigeria you only get the headlines about the Boko Haram concerns, and what you don't always get is some of the personal stories and some of the ways people are living and surviving and working around these headlines. And I think it's important to get those stories. I'll give you an example. There were a lot of the headlines about northern Nigeria, and at the same time we had them, as I mentioned, in northern India, about polio causing fears in the Muslim community that polio was causing, the vaccine was causing sterilization.
Okay, continue. Yes,
when we started to go around talking to some
yes.
of the mothers, they said, we said, is that really the problem? Is that really your fear? But in fact, when we talked to some of the people, at first they said yes, but then in further discussions we found out actually they said that because that's what other people were saying. But really, what they didn't like about the polio vaccination was that it was being given by a man and not a woman. And it was being given by somebody not from the village but from somewhere else. And actually, they had heard about the sterilization rumors, but it wasn't their biggest concern. But when you start sitting down and talking and understanding, you get the stories behind the stories. And I think the more journalists can get kind of challenging stories that challenge some of the ones that are currently out in the headlines. And what happens a lot, I see, because our project, our research here at the London School is monitoring media globally. And often we see mimic reports. Something gets out there that's interesting, and you see 30 versions of the same report. But what's really interesting is when you see a report that picks up on the event or the topic, but brings a different perspective. And I think, to me, that's really not to go against what's out there, but to bring another dimension, to go deeper, to go from walk in from a different door. In northern Nigeria, we talked to some of the mothers about this perception and rumors about vaccines sterilizing. And they said, the thing that makes us the most angry is when we hear on the news, and this was in local language and translation, when we hear on the news that the rumors are believed by ignorant people. And the women said to me, they said, we're not ignorant. We wouldn't be asking questions like these if we were ignorant. We would just accept it. And to take it from that perspective and really to kind of listen to the local interpretation. But I think bringing more diversity, and particularly now with global communications and the tendency for mimic and viral spread, I think the more we can keep a multiplicity of voices, keep a diversity, and bring another multiple views to the same issue.
One of the things that I think is interesting is that I guess there's concern that in conflict zone vaccination programs, may just have to be sort of put off until things can be calmed down. But then you hear reports that, there haven't been any reported cases in the DRC, which, they've had incidents and reports of conflict as well, but immunization programs seem to have continued. Are there, I mean, how do you deal with conflict and immunization? Or how do public health people deal with it, I guess?
Well, historically, there was something that they called days of tranquility, where UNICEF, for instance, UNICEF as kind of an independent party would negotiate with warring sides or different. They didn't attempt to stop the conflict because that was beyond the scope of an immunization or child health bills to stop for, say, one day to allow children to be program. But they did manage to negotiate to stop the fighting for a day. The problem with this approach today, it worked quite well in a number of settings, in Honduras, in Sierra Leone, in Afghanistan, for different vaccines at different times, and even other delivery of other health interventions in Sudan. But conflict, the nature of conflict is getting far more complex. And there's not just two sides in many situations, and it's not totally clear who to talk to, particularly in some of the situations in Pakistan and Nigeria. So I think in that sense, conflict is a deterrent, particularly when, I think it was really pretty dramatic to see that actually vaccinators were becoming the target. That's another change, because historically the concerns during conflict was that health workers would be caught in the crossfire, but that they weren't the specific target. And now is a new iteration where they're becoming specific targets. And even the police who are trying to protect them are also become targets. So it's a complex situation. And again, that's where I think journalists can help if you're local and on the ground and can give more understanding to the dynamics and look at how the only way to move in these situations is with local intelligence and local understanding of the issues.
All right. I don't want to spend all of our time focusing on polio, but just sort of one technical question, and this will come up in reference to other vaccines as well, or vaccine campaigns. One of the things I want to sort of, and perhaps this is a good transition point, there's now discussion or talk of trying to eliminate, at least, measles and rubella. So there's a measles and rubella initiative. But a question that I think sort of dovetails between polio and measles elimination, polio eradication and measles elimination, is like when the last case is reported, this is one of those elementary questions, will children still have to be vaccinated against these diseases? You know, what does that mean when we're down to zero? Yes.
With the eradication of smallpox, vaccination did stop. It didn't stop immediately, and certainly with polio, it won't stop immediately. And the first thing that happens is the transition to, which has happened in some countries, the transition to what they call IPV, inactivated poliovirus, and that's injected. And the difference between the oral drops, which is the live polio, is that it's more potent, and it's really important, particularly in some of the current settings where polio is circulating. But when you're close to the end of an eradication initiative, the natural immunity is down because there's less polio circulating in the population. And one of the reasons, and I think you had mentioned this, one of the questions that's come up is about what is this vaccine-derived polio, and that's literally the polio that's in the live polio vaccine, and that's one of the risks of a transition to eradication. But it also is because there's less vaccination in the population. So there will be a period where there needs to be vaccination even after we've seen the last case, but ideally hopefully at some point it can be stopped. But the other issue that is, again, wasn't an issue, or at least it was a bit of an issue, but one of the other issues that's always debated is the issue of biosecurity. And if there is virus in a lab somewhere that, if people are not continued to be vaccinated and the live virus gets into the wrong hands, can we afford to totally stop vaccinating? But it would be a very different type. It would be not as much. But these are all things that are currently in discussion with in technical circles about that, what they call the end game strategy.
Okay. With the Measles Rubella Initiative, the goal is to get deaths of children from measles down by as much as 95% by 2015, and eventually eliminate the disease in some regions of the world. It's estimated that, the measles campaigns have been very effective. In 2000, you had maybe 500,000 or more children dying from complications of measles. There's still a high death rate. You get about 158,000 worldwide. But one of the areas where it's been very, this campaign has been very effective has been in Africa. They had a greater reduction in measles deaths than in, other parts of the world, 85% compared to 74% worldwide. How did that happen? What accounts for that success?
Well, I think there's a few things. Some of the success is due to the strategies used and the confidence levels in the population with the ministries of health, with the public health officials, with the way they've been communicated with, and the way the interaction and kind of the environment of trust. That's one. The other is, go ahead.
I'm just curious. You said something about confidence level, and there was just a slight
You were asking a question
out.
about confidence?
Just after you said confidence level, there was just a bit of dropout, and I want to make sure that the reporters didn't miss anything. So that's all. If you could just take the question again, your answer, you were talking about the confidence in the ministers of health and the strategies being used. That's all.
Yes, the reason I think vaccine programs in general are more successful in some settings than others have to do with the public's confidence and trust in the people who are providing and delivering the vaccines. And if there's distrust or dissatisfaction with the Ministry of Health or the health services or the government in general, that can translate to a discontent about vaccines and vaccinations. And it doesn't have to be a distrust specifically in vaccines, but if they've had a bad experience with other aspects of health, it can transfer to vaccines. There are settings where there's very good relationships with the Ministry of Health and people are generally happy. But there are parts of the population that are more marginalized, are less trusting, and also their nutrition levels are less, there's more poverty. And one thing about measles is we, for instance, in the UK, have recently had a horrible outbreak of 1,000 cases in Wales, which is a small country, and 1 death. But that outbreak in Pakistan or in another country, they're having far more deaths per case. And part of that is because of the underlying immune systems, the health, the nutrition levels. A lot of times with measles vaccines, they give vitamin A drops and other things to kind of be additional boosters for the immune system. And that's so you might have the same levels of disease and measles cases in 2 settings, but far more children die in some settings where their underlying nutrition levels are lower or their there's poverty and there's other reasons that, and they don't have access to good health, so they can't take care of the measles quick enough. So this is where some of the contextual issues matter.
All right. Let me just be clear about something here. You're saying that some of the deaths from measles are not from, they can't be attributed to lack of immunization or lack of vaccination, but perhaps care. I mean, just help us understand, the effect or the impact of measles and rubella. I mean, do both diseases pose a similar threat to children or not, and why not? I hope I didn't.
Well, measles and rubella are, well, they're different. They're related, but they're different. They're different viruses, and they have different implications. But I think that anybody in the world who is unvaccinated versus vaccinated is more at risk of getting either of them. Let me talk specifically about measles. Not that I don't think rubella is important, but I don't want to confuse it by talking about the two as if they are the same. So even here, it's really the unvaccinated who are initially more at risk. But once two people get measles, whether or not they've had a vaccine, and the measles vaccine is highly effective. So say two people get measles who neither of whom were vaccinated. One is living in Pakistan or in DRC, and another is living in Finland. The chances of the measles cases causing more serious impact is higher in a place that doesn't have the health services and the immune things. Also, measles, some cases are quite mild and others can cause quite serious complications. So it's not everybody reacts the same way to measles, but everybody should be protected because you don't know. You just don't know, and you could get complications, and it's really, aside from the cost, it can be a very bad illness and very bad complications.
Okay, there have been pretty serious outbreaks, and you mentioned there have been outbreaks in England and also France, Spain, Wales, as well as Ethiopia and Nigeria. There have been, serious outbreaks of measles. Does this have anything to do with public attitudes, or I know it's the internet in some cases and organized opposition from certain groups? Just what impact? I mean, how important was the internet in contributing to, these outbreaks, shall we say?
I think the internet and social media certainly played a part in social networks of individuals sharing their questions and their worries about different vaccines. One of the problems is that the groups who question or delay or refuse vaccines are often tight social networks, and they can be geographically clustered. And the problem is with vaccines, if there were a scattering of people refusing vaccines across a wide area and a lot of people between them were getting vaccinated, it would be less of a problem. But the problem is they tend to cluster either a group of parents in one neighborhood or a school system, and that creates a hole in the immune system, so to speak. And this whole notion of herd immunity, which is like herds of cows, for instance, it's whole groups, if enough people or enough animals in a group get immunized, it reduces the amount of disease circulating in the broader group. So in some cases, certain vaccines, you need to vaccinate 75% of the relevant people to protect the broader group. In other cases, it's more like 90%. It varies with vaccines. But the problem is that these refusers and vaccine questioners tend to be together, so they create a big hole in the herd immunity. If that's I don't know if that helps explain it a bit, but it certainly contributed to the problems.
Sort of a hot zone where, you know, the disease is sort of very active, I suppose you might say. You say a
Yes.
hole. Yes. Okay. Just to wrap this sort of section on elimination and focusing upon, for example, measles and polio eradication or elimination, are there comparisons to be drawn between these two efforts? And how would a journalist go about doing, say, a comparison, or would that be a good idea or not?
I'm sorry, there were some gaps.
Okay.
The comparison between what and what?
Are there comparisons to be drawn between, you know, the efforts to eliminate measles and eradicate polio, or the diseases themselves, or, you know, lessons to be drawn from both efforts?
Well, I think the lessons are, I mean, together if you look at the lessons from both of them, you'll have a pretty good basket of lessons. They are different. What they have in common is they're serious childhood threats, whether it's polio, measles, or rubella. I mean, rubella is particularly a problem if a pregnant mother gets it and her child can have, well, they call it congenital rubella syndrome, but it can create all kinds of birth defects, deafness, blindness. So that's about the mother getting a disease that gets transmitted to the child. But the three of them are very serious childhood, have very serious implications for child health and long-term adult life. The way that they're delivered is well, measles and rubella can be in the same vaccine. The polio one is a bit different because in an eradication effort, they really need to get every child vaccinated and really at the 11th hour to everyone.
Okay. We have a journalist.
And the mode of delivery is different. You don't have, I mean, with measles and rubella, that's more of a, ultimately.
Sorry, Dr. Larson, there seems to be a kind of delayed effect with this system, with this technology, so that when you pause, then I jump in. But there are journalists kind of jumping in and out of the discussion. And one reporter from Zambia has a question about HIV vaccines and wants to know, you know, how far along are vaccine trials and what people are being targeted. Any sort of information you can give her to, I suppose, doing a story on HIV trials or an HIV vaccine and what's coming up on that in that area.
Well, we keep trying with HIV vaccines, but we haven't been very lucky. We've had recently there was another trial that was discontinued because it wasn't showing enough success. I think there's been a lot of learning, but I think there's been also more of an effort to try to share findings than there was in the beginning. But I think while the work continues in trying to develop an HIV vaccine, there's been a lot of progress on the use of treatment to suppress levels of virus, and even what they call PrEP, pre-exposure prophylaxis, that using a lower dose of the treatment as a preventive method. Now, it's not something you want to do all the time, forever, but for instance, if you have a couple that one is positive and one isn't, and they want to have a child, and therefore not use a condom, if one is fully on their treatment, the HIV positive one, and the HIV negative one takes, for instance, one of the dosage as determined during the period where they're trying to get pregnant, it's a very effective mode of preventing transmission during that time. Again, the longer term impact is, I mean, you wouldn't do that for life, but there is some progress in that area as an alternative. The work on HIV vaccines continues. I mean, to be honest, when you think historically how long it's taken for other vaccines to be developed, considering HIV was only first identified just over 30 years ago, it's a young, I mean, it may have been around historically for a while, but the work, the science on it, it really hasn't been that long. So I don't think we should give up on the AIDS vaccine. I think there's a number of people are talking about going back to the drawing board, and I think that there have been approaches to try different ways. We are not close to a vaccine. We are absolutely not close to a vaccine. And if we're not close to finding one, I mean, even when you find one that has robust phase 3 trials and ready to go forward, it still takes a while to get all the production capacity and delivery programs. So, I mean, I don't expect to see one in my life, but I hope that there's closer findings. I think that we still have to rely on a lot of other behavioral prevention methods. But the science has not stopped. It will continue, and there will be a discover one day. It's just a very complex, it's a very smart virus.
Yes, it changes even as scientists and health experts begin to get a handle on it. But to read, that question was from Monica Mayuni K of the Zambia Daily Mail. But to return to questions on, I suppose, vaccines for younger children, what we consider childhood vaccines, there are a number of, vaccination programs that, and one of the big things is people have argued or made the case that polio eradication campaigns would be good for routine immunization programs. Just where do things now stand with routine immunization programs? I mean, newer vaccines are being added to them all the time, but I mean, I hear stories that some countries have not, or parts of countries haven't mastered just simply getting those, the diphtheria, tetanus, and pertussis, or DPT vaccines, the tuberculosis vaccines, and the rotavirus and pneumonia vaccines to children as they should.
There are, I think most countries in the world have a basic immunization program. How many vaccines they've included on that varies for a number of reasons. Sometimes it's cost, sometimes it's kind of the disease burden in the country, whether or not they need a vaccine. The U.S., for instance, doesn't give the BCG vaccine. Other countries need it and give it. Some countries, for instance, India has not put HPV vaccine on its national immunization schedule, although you can get it in the private sector. It may get on the schedule at some point, but hasn't yet. what's also happening is there's more combinations of vaccines because so that a child doesn't, because some of the risk with vaccines is the injection itself, the hygiene, and the reaction to the injection, which is usually quite mild, but some children react differently. So one of the strategies is to incorporate more. It's one of the things that Gavi is trying to do, is to make the newer vaccines more accessible and affordable to poorer countries. But there's a limit to how much countries can afford. There's also a limit in terms of public acceptance of so many vaccines. And that's, I think, a bit what we're challenged with now in some countries. And it's not just in wealthier countries, it's in poorer countries too. People are questioning it with a growing portfolio of vaccines. Which ones do we really need?
Okay.
Over.
How would you suggest? I mean, I'm just sort of curious. What have reporters, when you're monitoring coverage even of routine immunizations or stories about vaccines in general, what are some of the things that you're seeing, and how has the African media, dealt with vaccine coverage? How would you assess it? Give us a kind of general view and what you think can be done to make it more effective.
Well, I think a lot of the coverage, interestingly, is on new launches and new campaigns. I think that what would be interesting is to look at some of the ways that innovative ways where people are getting a vaccine to communities, ways that they're involving non-traditional partners to help the delivery process, ways that they overcome issues. I mean, this is I'm thinking out loud in terms of news stories. Vaccine introduction. New vaccines seem to be more popular for stories because it's new. Yeah, I mean, also you could look at two vaccines, the same vaccines in different settings, and compare why is one doing better than the other. But even two different states in the same country. Nigeria, for instance, the routine vaccine coverage is dramatically different in the northern states than it is in the southern states. It's the same in India. Very different in Uttar Pradesh and Bihar. It's more like 11% versus almost 90% in some other states. What's going on there? It's not just about finances sometimes. It's not just about what are the things that in two different settings or two different villages, what makes the difference?
I mean, so is this about, are we talking about profiles of individuals who may be perhaps more motivating or motivational in some respects, or are we talking about marketing of vaccines? And when you say a difference between northern Nigeria and southern Nigeria, could you be more specific? Is routine immunization better in northern Nigeria, or less so than in the southern part of the country?
Well, the coverage is much less in the northern states for various reasons, and it varies. I mean, I think the thing to do would be to pick a state or pick a different area, and sometimes it is about individuals. Sometimes it's about the local health service. Sometimes it's about belief systems. It really varies, and I think the investigation from the reporter's side could be looking at, well, what is different? What is, and it's rarely, the difference is rarely about the vaccine. The difference is often about the context, whether it's the context of the health service, whether it's one particular health worker that has such a good rapport with the community. How does trust play into it? We also had, I mean, another interesting story in Africa has been the introduction of this, what they call Men-Afrivac, the meningitis vaccine. That's a fantastic vaccine, and they've been very. There's also a lot of innovation with it. It's less sensitive to hot and cold, so it is more robust. It can, you know, some of the cold chain issues can also be an issue. I mean, you could follow the cold chain. You could do a day in the life of the vaccine or a week in the life, because where does the vaccine start and how does it get to the people that, I mean, that's something that actually I think a lot of the public doesn't really appreciate or understand what care is taken in the delivery of a vaccine, from getting off the boat or off the airplane, or even if it's getting out of the factory, and the kind of special handling it gets, and how it gets from one place to another. I think following the story of a vaccine could be a very interesting story, and could help the public also understand that what that process is.
Yes, I mean, I remember once being in a health department. I don't know, it was a room, and there must have been 50 freezers in the room that were, you know, storing doses of polio, you know, packages. It was just, it was amazing to me. It had never occurred to me. I mean, I didn't have time to do that story, but I thought it was really fascinating that there was just this room full of freezers storing the vaccines. So the whole, you know, cold storage can seem like a very vague word, but if you break it down, the closer you get to the ground on something and focus in on a story, you begin to see issues that I suppose, you know, don't automatically occur to you. Are there other innovations that you can think of that come to mind in terms of either improving access or awareness of immunization that reporters should think about?
Well, I think that I was just thinking of another issue, which is when there is a basically going and talking to the local health center to find out what happens when someone does have a reaction to a vaccine. What's the process? How do people investigate and make sure that vaccines stay safe? Because that's a concern of the public. And I would find out what is the national system, what system is in place for when someone has a perceived they get sick, or there's some reaction or a perception of a reaction. Because what happens a lot is that somebody gets a vaccine and goes home and gets sick, or something happens, and they assume that it was the vaccine, and most times it's some other thing, but you have to investigate it to make sure, because if there's a problem with the vaccine, you want to make sure that you do something about it, because you don't want to have other people affected that way. But what's the process? What's the system in a country for investigating what they call adverse events following immunization? How do you find out if it was actually related to a vaccine or happens to be coincidental with something else? I think it's a positive thing for the public to know the safety precautions that are being taken. I think finding an individual. I mean, there's a lot of people who work on immunization. It's a fantastic effort globally. And I think there's stories that a lot of these immunizers, particularly ones that are in, well, you could probably interview someone doing vaccines in a city area and then in a more remote area. What is the difference in the kind of issues what's their experience? Are people happy about vaccines? Do they want more of them? I think there's many different angles you could take. But I do think that Yeah, go ahead.
No, are there groups or organizations which you would suggest that they speak with who, either, government agencies as well, but also just the civil society organizations or community-based groups that they should talk to?
I would absolutely, I mean, that's one thing I think any good journalist should kind of take the same question to multiple places and see what the difference in the answers is. Talk to the WHO person, talk to the ministry person, talk to MSF, and talk to or Médecins Sans Frontières, or talk to a local the local women's group, or the parents at a school. I think that absolutely talk to civil society, but I think that who that is, it will vary tremendously depending on where you're doing your reporting. I think every country has different groups, and I think finding which ones are more involved with vaccination. But I think it's also important to talk to people who are not just the ones engaged in the vaccination programs, but what do the general public think about vaccines, and what are some of the groups that are ones that where you can talk to parents or people who have children or are very aware of it. Talk to school teachers. They're not directly involved, but what do they hear? What do they think? What's their perception of how things are going with immunization? What's another group? But I think that we tend to focus inside immunization programs, following just the immunization people. But what is going on out there in terms of the general public? There's certainly a lot of public discourse here in the UK about vaccines, and I know in the States, and certainly in a number of countries. Unfortunately, there tends to be more public discourse about it when there's a problem, but I think it's a good thing to investigate women's groups or parent groups. There's also, we're talking about childhood vaccines, but I think one of the changes in vaccination these days is that vaccines are for life. And we're increasingly getting more vaccines, like the HPV vaccine is a very interesting and important vaccine. Initially, it was primarily linked to cervical cancer, but they're increasingly finding that HPV virus is linked to oral cancers, a number of other cancers, and it's a much more important vaccine than had been and already recognized. But that's also at a different age. It's more difficult to get to adolescents than it is to babies. Adults need vaccines too. They need influenza vaccines. And with aging in societies, we're going to start to need more booster vaccines.
I just, we're getting
because
close
the ones
to,
from childhood were not made for the long lives we have now. We've been quite successful.
We're getting close to the end, so I just had a very quick question and if you could do this very quickly, and that is, what about partial protection? You mentioned the MenAfri-Vac, and I think it only provides partial protection. How would a reporter address that very quickly, if you could, as we begin to wrap things up?
Well, I would follow, I would find out it depends what country you're in, but it's been introduced I think an interesting thing would be to look on the vaccine introduction in Nigeria. Last year, I think 2 of the 4 states that introduced the vaccine had poor coverage rates. Maybe a story trying to look at the use of it, the safety, the impact. I think it would be very interesting to investigate the introduction of Menafravac in Nigeria and where it's accepted and what are the issues with it. And I can certainly, if any of the journalists are interested, have some contacts that can help with that who are working in that program.
All right.
The medical director, yeah.
Okay. We're going to have to wrap things up now. If there are other questions, please, Dr. Larson will be happy to answer them for you. Dr. Larson, I want to thank you for taking time to, talk to our journalists. That's Dr. Heidi Larson, a senior lecturer at the London School of Hygiene and Tropical Medicine. And Dr. Larson will answer other questions for you by email. We'll post that address, but it's Heidi, Heidi, Larson, Larson, at lshtm.ac.uk. And don't forget, the ICFJ contest for the best stories should be submitted to ICFJ. We'll post a link to the site. The deadline for submission of stories is May 20th. You can also listen to this webinar again, if you like, on YouTube via www.icfj.org or www.ijnet.org. Thank you for your questions. I wish you the best in your reporting, and thank you again, Dr. Larson.
Thanks, Brenda, and to everybody.
I didn't hear all of that.
Okay.